Well, Nyka Alexander is from the World Health Organization. She joins us now live from Geneva. Nyka, good to speak to you this morning. So, a year after the outbreak of Zika, how are health officials dealing with the disease?
I'll tell you, one of the biggest challenges of Zika is actually communicating about Zika. It's very complicated. Most people who get Zika won't even realize they have it. In the maybe 20% of people who have symptoms, for most of them, it's a limited disease. The real concern is for pregnant women or women who want to become pregnant and the kind of effects that Zika could have on their fetuses. So explaining that and explaining that in order not to have this effect on your baby, you have to control mosquitoes is actually quite complicated.
Of course. And do you think that enough has been done to stop its spread? Of course, when this first broke a while ago, we were looking at the killing of mosquitoes in Brazil. There were many programs in place to try and make sure that mosquitoes were being removed from certain areas. Has enough been done, do you think, by officials?
In Brazil and in many other countries around the world, there used to be bigger efforts at mosquito control. We're talking years and years and years ago. And then your mosquito control efforts have an effect, and then your efforts go down. This is true for all of us. You start doing something right, and then when you see the good results, you forget why you were doing them sometimes. So mosquito control is something that all the countries where the mosquito that carries Zika and other diseases lives, mosquito control is something these countries must continue to do. And you need funds to do that. It's not easy to mobilize all the people to do it. And the funding is really still a challenge for WHO and within countries as well.
And what are you doing to make sure you get that funding then?
We ask for it. WHO has a plan that has been developed with other organizations that are also working on the response that explains all the things that WHO needs to do to help countries. So that's one side of it. But countries themselves need to allocate the funding so they can make this effort. And a lot of it does have to do with explaining the disease, explaining what you need to fight the disease, and it's very complicated.
And Nyka, just before we spoke to you, we mentioned that a baseball match or baseball matches in Puerto Rico have been cancelled because of players' concern over contracting Zika and passing it on to their parents. How worried should we be about the Rio Olympics?
Well, the Rio Olympics are no more or less concerning than everyday lives for people living in Brazil. So the tourists and the athletes won't be exposed to more or less disease than the locals face already. And so what's important, and as the locals are already doing their best to control the mosquito population, but especially if you yourself are a pregnant woman, to make sure you're protecting yourself from the mosquitoes. Your partner must protect themselves from mosquito bites as well. It's really not easy, though. How many of us can make sure we don't get one single mosquito bite? So that's why it's not just about the personal measures, but about what the community does together to control the mosquitoes.
And just finally, Nyka, are you advising pregnant women not to go to the Olympics in Rio this year?
WHO has advised women to really consider their decision of whether or not they want to go to any of the countries that are affected with Zika. So it's not singling out any one country, it's any countries. And as the season progresses, as it warms up in Europe, we may see the same mosquitoes spreading Zika in Europe as well. It's a possibility, and we still don't know what the effects might be as Zika comes back to Africa where it has been previously.
Absolutely. Okay, well, Nyka Alexander, we have to leave it there, unfortunately, but thanks very much for joining us there from the WHO in Geneva.
Thank you.